big sky, big potential. In association with Mills and Reeve, this is Eastern Promise. Achieving more together. Welcome to the Eastern Promise podcast, where we profile and showcase the very best initiatives and innovations, the teams and the triumphs from the east of England, and share them around the world. Are you working towards the evolution of our high streets? Or for better dental services in the east of England? Because Eastern Promise brings you a 2-for-1 offer. Wello, a state-of-the-art dental hygienist, is located on Station Road in Cambridge, mere footsteps from the station entrance. But this isn't just a vacant shop front being taken over. It's an entirely new way of experiencing dental care. I'm Mike Rigby, and my guests are Wello founder Felix von Nathusius and clinical director Shelley Belgrove on this week's Eastern Promise. Now, say, ah! Gum bumpers, mouth henge, the tooth fairy's delight. Your teeth have many names, and taking care of them properly isn't really optional. That's why, across our region, efforts continue to be poured into boosting access to dental services and increasing training places for new dentists. Yet what's equally, if not more important, is continuing innovation in the provision of dental services and an emphasis on prevention rather than cure, one of the NHS's shifts, all of which combine to prove that, in Wello, founder Felix von Nathusius has hit on something truly special. Along with clinical director Shelley Belgrove and team, Wello is at the heart of Cambridge's Station Quarter and offers an entirely different approach to providing the hygienist's part of the dental diptych. In surroundings far more akin to an upmarket hair salon in look and feel than what is often the clinically austere ambience of many a dental practice. Crucially, this also empowers prevention as a clinical strategy. And this was just one of the topics I discussed with Felix and a very busy Shelley Belgrove at Wello's High Street home in Cambridge. Well, 2024's Cambridge Startup of the Year. I saw that as I walked in the door of Wello here in Station Road, and I'm going to ask you to introduce yourself because I always miss bits if I try and do it myself.
Good morning, thanks for having me on today. So I'm Shelley Belgrove, I'm the co-founder and clinical director at Wello. So I lead the clinical team here. I graduated with a Bachelor of Science degree from Manchester in 2003. So I've got 22 years experience as a dental hygienist and therapist. My journey into dentistry began with some work experience alongside a really good friend who is a dentist. And although I always knew I wanted to sort of work in healthcare, I was initially unsure which sector to pursue, and my passion for creativity and practical work ultimately sort of led me to the field of dentistry, where I've found a fulfilling career so far.
Thank you. Felix.
Felix Nathusius, that's the best way to pronounce it, I guess, so thank you for letting me butcher my name.
Better than me doing it. I feel more respectful.
But I'm new to dentistry. I only started this about 3 years ago, founded Wello. I'm German, as you might spot, and moved here with my family, they're all British. My wife is British, and we moved here from Berlin, and I had a bad experience with finding a hygienist, and then I thought that it could be done differently, and that's how I came up with this concept and idea of Wello.
Well, we're in Cambridge, so people from all over the globe. This is really sort of the city in our region, the east of England, that really kind of so cosmopolitan out there in the streets and people around, and there's lots of reasons why that is. However, if you walk into Wellow, you are walking into a dental healthcare setting that really doesn't feel like a dental healthcare setting. And I think, Felix, when I originally visited, you described it to me as being more like a salon. And it really does have that vibe, the colours, the pastel colours, and the theme continues even into the the rooms where all the, for want of a better phrase, the action happens. Shelley, do you want to perhaps have a talk through with me? Do you want to talk through with me where that's come from? That really, because I go to my hygienist and they're lovely people, but it is still that quite white, clinical, I dare say cold setting, albeit with, as I say, lovely people. But where's the sort of idea that this is how it should be, and I think this is how it should be, come from?
I think, providing a welcoming environment is so important to patients because a lot of them have anxiety. So when we sort of were in the sort of planning stages of Wellow, we had quite a lot of help from a interior designer, and also Rose, who is also on our team as a co-founder. She is part of our branding and marketing. So we kind of really looked at what is our brand, what is our values, and then the ideas and all the colours and the scheme sort of developed from just having lots of brand and marketing meetings, and our designer helped us with our colours. We chose green because it's a very calming colour, and we chose sort of baby pink because that sort of signifies sort of healthy gums. We want all of our patients to, have healthy gums, and healthy gums are sort of pink, and pink's quite a fun colour, and it goes very well with green. So the two colours, really complement each other. So from the sort of onset to in the design phase, we had help from a designer who drew up some plans with how the reception sort of was going to look. We had help from one of our main sort of dental suppliers, Henry Schein. They've been great. They helped design sort of the surgeries. And we just wanted to create a nice flow for patients and also make it a nice environment for our staff to work in as well. And all of our values, I don't know if you can...
Yes, they are up on the board. Clean, joyfully rebellious, which I think is brilliant. That is such a... because it does joyfully rebellious, because it's not in a negative sense, but you kind of, in that very, sort of, dare I say, Cambridge, East of England way, sort of not so much shattering the norm, but showing in a really kind of positive, uplifting way how something can be done differently. It doesn't need to be the way it's been done. Why not do it this way, which is, as you say, calming? You don't feel like you've walked into in a good way. You don't feel like you've walked into a healthcare environment, something that's made you, that's their sort of a service for you. That is, I mean, I don't suppose having someone poking around in your mouth is ever what one might term a pleasure, but to make it as relaxing and positive as possible is a really strong feeling. Felix, how much has this been informed by your experiences back in Germany and how dental healthcare is run in Germany, and how much is just innately how you as the co-founder said, this is how I see it?
Well, not at all, because in Germany, I would say in particular, this part of dentistry is not much different. So you go to the dentist and you see the hygienist. And I think the UK is very forward-thinking to allow the hygienist or the therapist to do their job without being referred to by a dentist, which is called direct access. So the public has direct access to hygienists and therapists in the UK, but it hasn't been done yet. In Germany, you always have to go to the dentist. And there are nice dentists and not so nice dentists, but you have the same in the UK. You have beautiful dentists and nice dentists, and you have not so nice dentists, dental practices, I mean. And you have the same in Germany and I guess all over the world. Wellow is really the first one to pick this up and make that part of dentistry different and create an atmosphere that is not dental, because a lot of people have that fear to go to the dentist, and nothing reminds you of a dental practice when you come into our studio.
It doesn't. It really does not.
And that concept is new, and we worked with shop designers because they obviously know how to attract people from the high street into their shops, and that's what we wanted. So we have a shop front, that's particularly the location. We're not in a residential sort of back street area where most dental practices are, also in Germany, sort of on the first floor or tucked away in a building somewhere. So it's really about changing the way people see dentistry and make it visible as well. So you look inside. So we had a long discussion with our designers do we want the lobby to be visible? Does it feel uncomfortable for patients to be seen in here? And we ended up opening it up and saying, yes, we want people to see how it looks. We don't want them to obviously look into our treatment rooms and see what's going on there, which are beautiful and nice as well, but they are clinical. They are up to the standards of any dental practice, and we are a dental practice, so we have to be following those regulations. But the lobby, the reception area is transparent, and you see from the outside how it looks.
So talk to me some more about the relationship between the dentist and the hygienist, and because you really kind of breaking the mold, I think, because for me and for most people listening, they will go to the same practice for both things, and there will be a kind of expectation that you, to get one, you have to have the other. But you're kind of, as I say, we are literally a minute's walk, if that, from the front door of Cambridge railway station. You are in kind of one of the busiest professional areas of the city, with all the new shiny buildings on Station Road, and you've got Botanic House, somewhere I'm very familiar with, at the end of the road. So how have you approached that? Because I think when we spoke earlier, you had this really sort of interesting story of sort of asking the question, almost the impertinent question, why are we doing it this way? And wouldn't it be better if? So you want to talk through that for me, if you understood the word salad question.
Just breaking down all the barriers that prevent people from going to the hygienist or the dentist more regularly. So prevention is obviously key to your health. And we know and have realized that in many other areas. So nutrition, if you look into nutrition, our nutrition has become better over the last sort of 20, 30 years. We are fitter. We know that fitness is important to us, so we do the 1,000 steps or whatever. We go to the gym or whoever does more or less, but we understand the connection between movement and your health. And convenience is always the driver in those areas. If you can't get healthy food, you don't consume healthy food. If you can't readily go and visit a gym or do fitness or sport, you wouldn't be doing it. And that's why you have fitness studios all over the place, and there are 3 I can name in walking distance from here, catering that convenience or offering that convenience. But dentistry is always still difficult to access, and that was the main thing we wanted to break down. And fear is one of the big barriers the fear of the dentist. Because we are a dental practice without a dentist, that fear is already, we take care of that. Then the environment. And then what we actually use, we use a beautiful technology called guided biofilm therapy from a Swiss company called EMS, who developed this hygiene technology, which is literally pain-free and clinically so much advanced to the normal scale and polish, which is still done at about 90% of the dental practices in the UK.
So have you had any discussions with the NHS about the model that Wello is providing? Because it seems to me both exciting in that it's breaking down the barriers, as you say, minimising fear, offering sort of, this won't hurt, this is pain-free. And you're also doing something really interesting around high streets. regeneration, service-based regeneration, which is interesting thing in and of itself, because as online shopping becomes ever more dominant, what you're doing is what we need as a society, as the East of England, to bring more life back to our high streets. That's a very long, wordy question, but do you reflect on any of that?
No, I think it's a very good question. So maybe to break it down, the NHS it would be amazing if we could have more conversation with the NHS, and we're trying to reach out, and so far we haven't had luck to break that. And if you look at the trusts or the NHS, they're responsible for health of an entire country, and we are a concept. We are a startup. We have, I think, proof of concept, because we're seeing that we are getting a lot of patients. We are reaching a lot of patients, and we are getting a demographic which previously has not engaged with dental health and oral health, and they come to us and they come back to us. So we have a very high return rate as well. So as a model, it would be really interesting for the NHS. And I'm very happy to say the NHS is now looking more at prevention. At the moment, oral hygiene treatments are not on offer at the NHS. So you can go to an NHS dentist, but prevention, teeth cleaning, hygiene appointments are private in that setup. So, but one of the top 3 priorities of the NHS towards dentistry is shifting from treatment to prevention, which is great, and that's exactly where we are. And they realize that in other countries you have less dentists per capita, but you have a better dental care because prevention is more of the focus. And we've just recently heard of a program which we tried to we're trying to be in touch with them, and the NHS is part of that as well. It's called Mind in Cambridge, and it's a program of the Joint Authority. It's called Work Well, and it's helping people to stay in jobs and get into jobs, and it's more about mental health, but there's oral health and mental health is very much linked, and we have these examples of patients who came in here with stained teeth, and they weren't very confident in their whole demeanor, and they didn't have a job as well. And then they had the clean, and they grew more confident with their smile, and they came back a few weeks after, or a few months after, and they now have become regular patients, and they found a job. They are now in a job, and they're back in that part of society, which is really important. So they're great examples, and we want to multiply that. And the high street aspect of it is really a good one as well. So we want to revitalize high streets with these kind of services, but make it really present as well. Make dentistry part of, and oral health more part of your thinking.
Well, we can welcome back Shelley now, because this is such a busy practice. Shelley has, if you couldn't detect, has left us temporarily, but we're delighted to have you back with us now. So I don't need to cut it like you weren't here, because I think it's good for people to hear that it is quite bustly in here this morning. You're wearing lots of hats, and say, Felix and I, we were discussing sort of the interplay with the NHS and prevention and the importance of prevention, and it seems to me that lots of conversations in the East of England, which obviously my kind of self-appointed bailiwick, around prevention. And I'll just offer this up first as an example, an interesting one I had with Jonathan Clark at the John Innes Centre, which is obviously a hub of plant science in Norwich, was around maltodextrin, and how when you open a tub of Pringles, or other crisps are available and they've got maltodextrin in them, that's what makes you not just have the first crisp or the second crisp, but the third crisp and the fourth crisp. And where the hell's the tube gone? Maltodextrin's obviously Jonathan can explain it better, but a big part of that. So in terms of obesity and better diet, there are, Jonathan would tell you, were he here, there are big pluses to our health to replace maltodextrin with perfectly safe and non-addictive alternatives. In terms of, again, what you're doing in terms of prevention, it's that if you're constantly firefighting, i.e. you'll not actually make any progress, you'll just end up having to treat more and more patients with fewer and fewer resources who have got worse and worse conditions because nothing's stemming the tide. Whereas what you're proposing and this model is all about stemming the flow of serious conditions by sort of being there early doors and being that preventive force. What does that mean to you to be that, to sort of shift that model over to prevention?
Yeah, I think prevention has always been part of the role of a hygienist and therapist. We don't just treat and clean teeth, we're ultimately sort of educators. So when we see patients, we take down a really detailed sort of social history. Do they smoke? How much do they drink? What's their diet like? Obviously, how many times a day are they brushing their teeth? Are they cleaning in between their teeth? So we get a sort of full picture in the initial appointments with patients. So we can kind of build a kind of picture of how, or just lifestyle habits and things. And obviously there's so many links now with systemic conditions and oral health. So we are looking at the overall well-being of patients, not just their oral health, because there's so many sort of interconnections. You've probably heard and read in the media there's links with cardiovascular disease, diabetes, dementia, Parkinson's. It's all really being sort of highlighted and brought to the spotlight in the press. So we really want to kind of make sure patients are really taking on board their oral health. So when we see patients, we really sort of educate them on their nutrition and help them with giving up smoking if they need that help. And we just talk about alcohol because there's so many links now with alcohol and oral cancer. And gum disease is one of the biggest diseases that we treat as hygienists and therapists. It affects about 70% of the population, and a lot of people are unaware that they have it. So it's really important for us as clinicians to inform patients that they have this disease. And how we can help them get stable and treat it. So we do a lot of gum disease treatment here at Wellow, and really try and get patients on board with their preventative care at home. We always say to patients, 80% of your sort of home care routine is down to you. 20% is down to us as clinicians. We're not magic, we're not magicians, we can't fix all problems, but we are...
Yeah, it's not like a confessional, is it? You don't go to the hygienist and say, get absolution for my terrible dental health practices. And let me just ask you a question. I'm not saying this is for me, but when you ask people do they floss and they say yes, do you always believe them, or do you know when you're looking in their mouth, you don't, do you?
You can often tell.
Right, well.
So there's no hiding. We will always spot if a patient says, yes, I floss every day, and then you're probing around and you're finding half their lunch in the middle of their teeth, then you know they're not quite doing it. But I think they like to impress us, and it's all about behavioural change. So we always explain why it's important to clean in between your teeth, and why it's important to brush twice daily with an electric toothbrush. Just explain about the bacteria, how it sort of affects your gums and causes inflammation. And going back to your sort of original question, prevention is key. If you really lay down the foundations of prevention in those first appointments, you will get patients on board, and you'll sort of build that lovely rapport with patients. Sometimes patients take a little bit of time, but I think the more you see patients or repeat appointments, often they will realise, I really need to do something about this. So you don't just get them in the chair and treat them, you really have to kind of plant those sort of foundation, all that information at the very beginning of appointments, and hopefully they will follow all your advice. That's all of our hopes as hygienists and therapists, that they kind of take on board what we say. But some patients, like Felix was saying about mental health, some patients do struggle with that, and sometimes even getting out of bed, in the day is hard for some. And often if patients have mental health conditions, they neglect their oral hygiene as well. So we have to kind of tailor our appointments to each patient's individual needs and how we can help them. And sometimes it's a slow journey. Some patients patients get on board straight away. We sort of treat everyone individually, and sort of, each appointment is tailored to the individual.
And we, just to emphasize one aspect, and you hit on our joyfully rebellious approach, and we understand health is a difficult, and lecturing patients about their behavioral or oral health habits is not what we are doing, because it wouldn't work. But what we're doing is we're providing information, and we work with something called the plaque score. So every patient gets a plaque score, which is a very objective measure of how your habits impact your teeth. And it basically gives you a percentage how many parts of your teeth are covered in bacteria. And you have about 60% of the surfaces that you can reach with your toothbrush. So if you're not flossing, your plaque score is 40 or above. And providing that number and gamifying that number, which we've seen really fantastic results with, particularly with children and couples. So I'm losing the battle, but I'm fiercely fighting with my partner about plaque score, and I've come close to where she is. But all my children had a better plaque score than I have. I have an 8-year-old daughter who, since we introduced that to her and she wants to beat her older sister, she's flossing her teeth and using interdental brushes. So I don't need to tell her to brush her teeth. She's doing it herself, but she's also doing the flossing and the interdental brushes just to beat her sister. So having a playful way to introduce these topics, and then having adults, children compete on that, and it's a bit like I don't know how you call those watches that measure your steps. Yes. And the smartwatches, and I mean it's completely. I'm a runner, so I go running, and I did my 10Ks most of the days, and when my wife gave me the smartwatch, I improved myself, but I also realized when I didn't have accu time left on my watch, I would walk home. So complete irrational behavior. So you stop running what you love just because your watch doesn't track it anymore because you had no battery left. And then you walk home. So funny behavior, but the same behavior we use for plaque score. So gamifying something and making them want to improve. And at the end, the result is fantastic because they improve their oral health and all the implications that Shelley mentioned with it, gut health and heart disease and these things.
And presumably, this is just a boring technical question, but presumably, should you feel the need, you can say, I need to refer you on to a...
Yes, again, that's a really interesting question. We work with some referral practices in Cambridge. A lot of the hygiene treatment we try and do in-house. So we treat gum disease, so we do the non-surgical approach first, and often we get very good results. Our clinicians are very skilled. If there's an area in the mouth that's not quite responding and it's out of our scope, then we will refer that patient to a periodontist, which is a gum specialist, and then they take that patient on, and then we put them on a supportive care journey after that. So their oral hygiene and their sort of periodontal disease, once it's in a sort of remission stage, can then be maintained. But again, it's really sort of making sure we're seeing those patients who are high risk, are coming every 3 months to have regular cleans. But yes, we do have a referral pathway. If there's something that we can't treat in-house here as a hygiene patient or a therapy patient, then we refer outwards. We always put the patient's best interest first, and we give them all the options available.
It occurs to me what you're doing quite cleverly is you are making this almost, dare I say, an aspirational thing through the gamifying and as well through the salon feel, the really comfortable, welcoming feel that is miles away from most people's experience of healthcare, with the best will in the world. And that, I think that's incredible that there's like, it's a place you want to go in. And I think you hit upon it slightly earlier, that people will want to impress you by sort of taking a bit more care of their teeth and sort of saying, well, I went to see Wello and I, ding, here's, you can hear these like nice bright white choppers because, I've really upped my game, gamifying as we say. So I think that's really, really commendable. Is that something you wanted to be, or is that something you hope you would become with Wello, Shelley and Felix? But yeah, is that what you were aiming for?
I think I've always been a hygienist and therapist that is very thorough. I've done plaque and bleeding scores most of my sort of career, and I think at Wello we're just having slightly longer appointments with patients. In past practices where I've worked, often appointments have either been 20 and 30 minutes, which can't always get the message across, or you feel like you're sort of rushing patients. So just having a little bit of extra time with patients really helps, especially for the first initial appointments. So we always have a 45-minute to an hour appointment with any new patient, because that's where you set all the sort of goals and the standards, and that's when you really educate. And then sort of follow-on appointments can be slightly shorter if they need to be. But we kind of really wanted to provide the best patient care for our patients. And I think Felix sort of touched on the guided biofilm therapy treatments. We wanted to offer that as standard. We didn't really want to have to upsell that in an appointment. We wanted to give patients, the best treatment with the latest technology. And I think with plaque and bleeding scores, that really does motivate patients, and it gives them that feel-good sort of factor that, yes, I'm really sort of trying hard at home. I've been to my next hygiene appointment. I've got my plaque score down, my bleeding score down, and I'm feeling sort of empowered to kind of keep it all going. Some patients sometimes slip a little bit and they need sort of putting back on the sort of hygiene train and become more motivated again. But I think, we just kind of set the standard that we wanted to make it sort of convenient for patients to come to us, easy and enjoyable, welcoming, but also providing gold standard care. And all our clinicians are really highly trained. They've all got degrees and diplomas in dental hygiene and therapy. They've all done the specified training in guided biofilm therapy. So when you're sort of recruiting clinicians, I always make sure everyone is fully GBT trained, and they're providing the patients with the best care. And I think when you have sort of high standards yourself, you want to kind of project that into your own practice and going forward, really.
But I think the new approach Wello has, and it's in the name as well, because hygienists and therapists, that profession has been around for many years. But if you probably would go out onto the street now and ask people what a hygienist or a therapist is, very little people know that, because only very few people go and see the hygienist. The dentist, everybody knows what the dentist is. Everybody knows what a dental nurse is. But that you have very professional dental specialist in between the dentist and the dental nurse is something people don't know. So our approach is really is a different one. We created Wello as a well-being, or we're part of the well-being world. So it's the fusion of health and beauty, and this is what people want now. They want to feel well. They want to be beautiful. They want to be healthy, but they overall they want to feel well. And that well-being trend is where we positioned Wello, and that's in the name as well. Wello, the well stands for well-being and oral well-being, and therefore having this new approach is, I think, the uniqueness of Wello, and positioning Wello in a different way than from an ordinary dental practice, where you can have expert hygiene appointments and you have expert dental appointments, but the overall well-being and the convenience that we provide is unique and different.
So lastly, Cambridge Startup of the Year. That must have felt pretty good, because you usually think your startup, you're thinking, some kind of tech tech bro or some kind of genetic process in one of the labs, but for a high street business, that must have felt pretty good.
Yeah,
it was amazing, and you were spot on with your analysis. We were flabbergasted among all these tech companies and companies who provide life-changing medical devices or things like that. So I think what the jury realized is the dire need of something to happen in dentistry, and something positive to happen in dentistry. Dentistry is always negatively portrayed. You read so much and hear so much about dentistry, which is negative, and dental access crisis and toothless in UK, and everybody sheds a very negative light on dentistry. And we're trying to change that and change the agenda, and we've realized that we can. We're seeing between 50 and 100 new patients every month, which is, I don't know, in terms of hygiene patients, probably 10 times more than an average dental practice. An average dental practice gets about 25 new patients every month, but that's overall their scope of practice, and not only hygiene. And we get only hygiene between 50 and 100, and we've done that now for 9-10 months in a row. So it's really working, and the jury saw the potential we have to create an overall better society if we tackle this oral health aspect.
My huge thanks to Shelley and Felix for their hospitality at the Cambridge Startup of the Year 2024. It's hard to convey by sound alone just how different an experience Wello is, and if proof were needed that this model can apply more broadly than dental services. Felix has since informed me that one of his partners has since achieved the CQC registration needed to offer GP services at the Wello studio, making prevention even more a cornerstone of this new high street approach to primary care. For more information, please drop me a line at podcast@easternpromise.org.uk, and I can make such directions as might be necessary. And that is it for the episode that is the Big 140. I have been Mike Rigby, and will be so again in just 6 weeks. 6 weeks? Oh, okay, 6 weeks' time, 42 days for your introduction to the potential-packed professional paradise that is the Kings Lynn Enterprise Park. We'll hear from the Borough Council of Kings Lynn and West Norfolk, Norfolk County Council, and the park's anchor tenant, medtech innovator Mercksin. So, as we press pause for August, please note your calendars that we will be bursting back on the 4th of September with guests, including these fine individuals.
My name's Simon Ring. I'm Deputy Leader of Kings Lynn and West Norfolk Borough Council.
Gemma Curtis, I'm the Regeneration Programmes Manager at the Borough Council.
I'm Graham Perkins, the co-founder of Mercksin and Chief Technology Officer.
I'm Jennifer Wigsell. I manage the Enterprise Zone programme for Norfolk County Council.
Piers Ricketts, Chief Executive of Health Innovation East, welcome.
Thank you very much. I'm delighted to be here.
We're here with the two leading lights of the CamTech podcast, and I would like to ask them to introduce each other. We're here with Faye Holland and James Parton.
This is James Parton. I would introduce James as a very connected, really lovely person who gets things done.
Faye has always been a huge supporter of the community, very much a role model in terms of paying it forward.
I'm here with Rosa Marks of the Bennett Institute for Public Policy at Cambridge University.
Francis Metcalf, Head of Biotechnology at Cambridge Consultants.
And Richard Treherne, Head of Next Frontiers, looking at those new technology and innovation areas.
It is an absolute delight to be here with my very good friend, Dr. Penny Hundleby.
Okay, so I've been at the John Innes Centre working in genetic technologies, and I've recently moved across to the Directorate.
That's a fraction, I say, of what's to come in 2025. We're also sending out our summer survey, so keep your eyes peeled for that. And in the meantime, if you, that's you, have a story about excellence in the east of England, then don't hesitate to drop me a line at podcast@easternpromise.org.uk. That's podcast@easternpromise.org.uk. So, enjoy the summer holidays, and until September, bye for now. To hear other episodes of the Eastern Promise podcast and to find out more about what we do, go to our website at easternpromise.org.uk. Eastern Promise is a Podding Shed production in proud association with Mills and Reeve. Achieving more together.